Talk health. It has been 7.5 decades of service by the World Health Organization to humanity. It is stressing the need for a renewed commitment to health equity, which will be the key to addressing future health challenges as the global community marks the World Health Day. Health correspondent Kemi Balogun takes a look at how Nigeria has fared in actually providing health for all.
In the African region, about 25% of health expenditures come out of people's pockets, and as a result, millions of people are further pushed below the poverty line due to spending on health. One major aspect of the drive to achieve health for all from the perspective of the World Health Organization is the attainment of universal health coverage. This seeks to provide affordable, equitable and sustainable health care to all its citizens. For this to be achieved, two key themes need to be addressed: health insurance and the improvement of the primary healthcare system. These two remain largely unachieved. According to a 2021 report, only about 3% of Nigerians have health insurance. The country also accounts for about 30,000 primary healthcare centers, but only 1/3 out of this number are functional, plagued mainly by several challenges revolving around poor governance, poor human resources, and inadequate funding. The challenges continue despite government's intervention to achieve some strides in the health sector. In recent times, non-profit organizations have carved a niche for themselves while supporting communities. With a population of over 200 million, Nigeria accounts for numerous challenges when it comes to healthcare, but with little interventions, it can get to close that gap which government cannot reach.
At least I can say over 80,000 people have been reached with these activities in the community, and we have the data that have shown. And for in the aspect of HIV, those that have tested positive, we are in care, they are in care, and then we still retain them in care, and they are doing very well. So we have a lot of ways to reach out to them through the community. In each community in FCT, for example, we have a particular team that works there.
They create little impacts by closing the gaps that exist in getting healthcare in these communities, but their efforts have remained like drops in the ocean. Yewande's organization is one out of thousands who focus on providing healthcare support to some selected communities in the Federal Capital Territory.
We pay bills, pay for tests in advance. Okay, we want to pay for 20 women. Like I told you, we are women and children based. Pay for 20 women. When we're there physically, if we notice, okay, I think that there are sometimes we paid bills for aged before and all that. So the bridging that gap is a massive one. We have a very long way to go. Very long way to go. Even the established hospitals have their own challenges, let alone health centers.
She is worried that the lack of funding to organizations like hers could still set communities back and reduce the help they give out.
Most NGOs are underfunded. We have international organizations giving grants. Sometimes it doesn't come to us. Sometimes you don't get it. Sometimes you apply, they tell you need to go through your government. Whether it gets to government or not, we don't know. It never gets to us. So that, to an extent, limits what we can do or what we can give to them. Most of them don't even have well-equipped laboratories. The only test they can basically run is maybe culture test, wider counts, and then anti-malaria. Those are like the major tests some of them can do.
Addressing the root causes of these challenges that hamper the effective delivery of health care is what the World Health Organization is urgently pushing for as the world marks the World Health Day. It also calls for a paradigm shift towards promoting health and well-being in preventing diseases.
When we see someone coming, we should already think of intervention in the community that could prevent the same condition reaching others. So that's the concept WHO is trying to drive. So multi-sector policy and action, community empowerment so that they can make the choice, and in inequity, we are also missing that own community participation to contribute to their own welfare and well-being.
Learning from the worst pandemic in recent history, the global health event comes with the need for African countries to protect healthcare systems through the provision of support to build the capacity of health workers to improve health resources and services across all levels. Kemi Balogun, TVC News, Abuja.